class. I hope I have your attention. I really am looking forward to hearing your responses from the unnatural causes and sickness and health video that you watched and the readings, etc. Let's talk about addressing social determinants of health. It's time to get started. And where are we? Do we know what the social determinants of health are? They are the social factors that influence health, not just at one point in time, but over the entire life course. And what do I mean by that? From cradle to grave, or from womb to tomb, from the day that you are born, these social determinants are carried with you. There is a cumulative burden. So, for example, if you live in a society where one race or ethnicity is at a disadvantage, it will determine, likely determine a neighborhood that doesn't have a lot of advocacy, that might have lower quality schools. If you attend a lower quality school, you might have lower educational attainment. The lower educational attainment may lead to lower job potential, lower earned income potential, etc. There is just a cascade effect of the doors that will close for a particular social determinant. So it can also rob populations of productive years of life lost and impact the quality of life that a population can live. So 3 overarching threats to social determinants are economic inequality, social connectedness, being part of a marginalized group that doesn't have the ability to come together and advocate for better conditions, are going to be marginalized, and the sense of efficacy, the confidence in being able to change and come together to make improvements. Those are threatened. So what does it result in? Differences in exposures, differences in vulnerability, and differences in the consequences, health consequences, economic, etc., for different populations. It is not something that is universally experienced. The social determinant is variable by geography, by ethnicity, by race, by gender, by class, by whatever the social structure is. So some specific social determinants can include racial and ethnic biases, cultural differences, media influences, politics, living conditions, geography. We're going to go through even more. So now we're going to get into why. Why do we care and why do we address them? Because if we want to solve problems and prevent disease and prevent negative health impacts that are tied to lifestyle, we must attack root causes. And social factors have more resonance than just the health issues alone. If you remember in the Unnatural Causes film, your Mary, the one in the lowest social class, she feels her health conditions, but it is not being able to go on vacation, it is not being able to put food on her children's table, not being able to live in a safe place. Those have the greatest impact versus her health, her wellness. So addressing social determinants involves a comprehensive approach, which you have to work with communities that have been isolated so that you understand them, that you see the situation through their eyes, not as an scholar or an academician, you must get to know your community in order to both maximize the return on all of your investments in public health as well as the value of your investment. And addressing social determinants presents a tremendous opportunity for learning and community leadership development. So how are we going to do this? Well, we need to address social determinants when it's clear. We can't just look at heart disease. We have to go further. Heart disease is skyrocketing. Obesity for women is increasing. That was just in the news. Just focusing on a medical condition, prescription drug abuse, we have to dig deeper, because when rates are not dropping off like they should, we need to find out why. And we need to advocate for changes in laws and policies and get more research attention for things that are keeping, a veil on what's the dynamics of what's causing that. And we need to also seek fundamental change so that we can achieve long-term solutions to long-term problems. And if we really want, and we want to walk the walk or live the life with the song we sing, we must focus on true wellness and prevention overall, not, like I said, putting a Band-Aid on something. It is truly making a community healthy and vital and integrated back into mainstream society. So how do we identify social determinants? You assess your communities. You respond to observations and experiences. I know a lot of you in your personal introductions, you have traveled to many different places, but you don't even have to look that far. When you come to GSU's campus or any community you live in, you know there are homeless individuals, there are people that are poor, there is no end to suffering. You must, instead of turning that blind eye and getting thick skin as a bystander, you have to start asking more questions and muster courage to shake off those things of just letting things continue. You have had friends who have experienced things. You have had family members. We are not, the degrees of freedom that you are separated from the health problems in which we're trying to improve in public health is not different. We're part of the public. So we need to work together to get this hard work done. And there's tools to help us address these, and we're going to go through all of them. We're going to figure out how we can change social environments, physical environments, policy conditions by increasing people's knowledge, increasing their skills, by offering support both within and between different groups, modifying access to or barriers to get to resources, opportunities for services and resources. We have to have consequences when actions are deliberate and perpetuating social determinants of health. We need to address exposures to hazards or protect people from those. And we ultimately, the greatest tool we have that can have the most amazing public health results on a population level, we need to advocate and change policy. So we have guidance provided by our principals that we can't do this work without having a task force. We need an entire group of people, and not, like I said, you are so lucky to be in grad school, and it's wonderful, but you must be the lead of a movement. You must involve the people that are affected so that your ideas for solutions have the best chance of succeeding. And true change in improving social determinants demands comprehensive intervention. So you learned about the ecology level. We can't just try to fix obesity by having personal diet plans for individuals. We need to fix zoning policies so that, you know, on Martin Luther King Drive, it's not overrun by fast food joints and pawn shops and everything else. We need to really fight for fresh produce and get rid of food deserts and recreate areas so that health can exist. We need to support organizations that build capacity so that a community can control its own fate. And I missed bullet point number 3, that we have to aim for change across sectors. We can't, we need to really foster relationships between law enforcement, social services, healthcare. You know, physicians and the medical community is just one part of health. There are so many other partners that need to be present: schools, workplaces, homes, counselors, you name it. Everybody has a place in public health. And health and development efforts should involve collaboration. These strategies that we come up with should be self-sufficient and sustainable. They should be aimed at goals that can be accomplished by people in question with resources available. And success should be consolidated and maintained so that the next challenge can be taken on. So we should continually advance. We're constantly getting better. And when we have one milestone met, we can push forward and get the next one.
Okay. Thanks for watching that, guys. I'm going to turn this off now and take everyone off mute, and we can engage in a discussion. So we're going to be doing an activity today to talk about the issues of power, privilege, and discrimination and how they influence health status and nature of relationships between community health workers and their clients, and also the communities with which you all work in. So I would like you to draw upon your textbook reading for Chapter 4 and resources, personal and professional experiences, and talk about how you all have experienced or witnessed how power, privilege, and discrimination works. You might be wondering why we're doing this activity today. We're doing it because as you're working with individuals in your community, you'll need to identify their struggles in order to help them overcome obstacles. So I would like each of you to take turns and talk about how you define power and how power is used in our society to influence health status. With that said, keep in mind and think about how economic and political power are used to determine access to the key resources and rights that all people require in order to be healthy. So when you're thinking of what actually influences economic and political power and how it actually trickles down to people's health status in our communities, even your own, what does that look like, and what do you think power means in our society, and how does it influence our health? So I'm actually just going to call on Karen to go first. Karen, could you tell me how you define power and how it's used to influence health?
Power. I was kind of thinking like discrimination.
Okay. How do you think people have experienced discrimination when it comes to their health?
not getting the proper care that they need for their health, uh, where they're located at. Um, if they're in an area where it's being labeled, or a community.
And could you give an example of maybe how people in different areas might not have access to certain services? Um, and if they maybe had more power, they would?
It's kind of hard because, Sandpoint, we're just an island. And, like, for women, we have to go to Anchorage to get mammograms because they don't have the proper stuff here at the clinic to do the mammograms or the ultrasound. Women leave the island for like a month before their baby is born because we don't have ultrasounds. I mean, I don't know. It's kind of different with rural and city life. I don't even know if I'm even hitting the nail on the head.
Well, there's definitely not a right or wrong answer, but I think you drew attention to an important thing that realities that people in various communities of Alaska, especially rural parts, might face limited services. And that's just a result of being, in those locations. So it may not be intentional that they can't, have their babies in Sandpoint, but maybe if those individuals had more power or political influence, they could, make sure that OBGYN doctor is there and someone in the community can assist with childbirth. So we oftentimes don't put politics and healthcare together, but really politics directly influence how healthcare is, given, received, paid for, executed. So that's actually a really great example of how some power can affect or not affect. And I know I've heard in other rural communities where they don't have an eye doctor or a dentist. So these are health inequalities that people face in real life. And if you have a rotting tooth and you don't have a dentist to go see, that could really be debilitating. So I think that was a great example, Karen. And so we'll go now to Kelly Fields. Can you talk about power and how it's used in our society and in your community, Kelly, to influence health?
Yes. So empower, and I like to empower our patients in the villages by bringing resources to them and giving them a better understanding of the health field, because a lot of my people do not know how to navigate. So giving them that power and understanding really improves their morale when they're out there, not in the village, but in the cities, at the hospitals and stuff. And giving them my cell number if they're having problems. They call me anytime they want. I'm available at any time. Helping them get resources out there to them, like, for instance, we brought Medicare, VA, Medicaid, all officers of the state, we brought them out to them with a bilingual teacher. And it made a big, huge difference with everybody on site, instead of just sending in forms to people they never met before, So one-on-one with most of them, it seemed to help. So empowering my people.
Great. Well, that's a positive way to help people and help them where they are. which is a huge component of being a community health worker. So you've already got a great start on acknowledging the help people might need. So you've done some research and you're closely tied to your community, and then you have brought in specialists to help them where they are. So you're helping empower them, and also you're powerful in yourself, Kelly, by organizing these things, because if you didn't organize it or your organization didn't, who would, help them wherever they are? So that's how you're exerting power. And then Linda, thanks for typing in, Linda. She is only by chat today. She says, power and health are organizations who make decisions and assumptions on a patient's health without knowing the full picture, such as their housing situation, work environment, and culture. It's important for the power to be distributed among health caregivers and patients. Patients should be able to have resources immediately available to them, such as know where they could go to have a better quality of care. Again, this is why it's important to advocate for patients and individuals so that power is more equally distributed. Thank you so much, Linda. That's so true. So what we can do, what we've discussed today is things that we've identified that are deficient, and we've also talked about how we can address that equal distribution of power and empowering our patients. Next, thank you all for your participation on that. Next, I want to talk about privilege. Privilege is defined as a right, advantage, or favor that is given to some people and not to others. So privilege provides some people with greater access to key health resources such as quality education, health care, clean water, air, safe housing, bank loans, and other financial resources, employment, and civil rights protection. How do you define discrimination, and how does discrimination influence health status? Could someone talk about how you define discrimination and how it might influence health outcomes? And I guess we will go back to you, Karen, if you could talk about discrimination.
To be left out, discrimination.
And do you know of any discrimination that might happen in gender, religion, nationality, sexual orientation, mental health status? Have you acknowledged, and do you know about discrimination and how it might occur in healthcare?
No.
Okay.
Really isn't a problem here.
Okay. Well, how about you, Kelly? Do you know about discrimination, or do you have any comments on this?
Yes, I have a comment on everything, Haley. Yes, discrimination. We're having a huge amount of alcoholism in our villages, and we started to notice a lot of people that is under the influence come into the health clinic, and before they were just really looked down on, coming into a community with drinking, intoxicated, that a lot of people just look down and talk bad to them. So we started to turn that around and talking with them one-on-one like anybody else, and it's making a huge difference because they notice that we do care and that we're not looking down at them, and they seem to be trying a little bit harder at being sober.
Great. Yeah. You can often help people more when you try to put yourself in their shoes and take off your judgmental hat. We're not in court. So thank you for that, Kelly. Linda writes, discrimination in healthcare results from assumptions. For example, healthcare may not be offered to someone who is an alcoholic because one might think that the individual may just go back to drinking. It's wrong to assume what an individual might do. Everyone deserves the best health care despite what one believes about the patient. Judgment should always be reserved. That's really true, and thank you for that, Linda, and thank you all. Some other examples of discrimination might be providers that treat patients with Medicaid, Medicare differently. People who are lower income may be rejected for services from some medical practices. They can write in there, we don't accept Medicaid, even though they could get Medicaid approved, or they don't accept Medicare. Some practices don't accept or don't recognize veteran benefits. So those are like institutionalized discrimination. So you have to know where you can go if you have Medicaid, and that is, in essence, a form of discrimination. It might not be like a prejudice thing, but it does come out that way. And so as community health workers, it's important for us to know in our communities, the population we serve, what discrimination they may face, and how we can help them overcome those problems, because it may be a barrier between them getting access to vital services. So that's why we're talking a lot about discrimination, power, privilege, and health. So in drawing in conclusion to that, what do you think you could do in your community to identify like true problems that people might be facing, or at least becoming more aware of them? Do you guys have any ideas for how you could learn more about disadvantages that are happening to individuals in your community, or you might know of a certain group of people that experience discrimination? How can you address those issues and then learn more about them? Any ideas?
Here on Sandpoint, we have a lot of cannery workers that show up, and a lot of them, they're not on Medicaid, they're non-bends, and we offer a sliding scale fee to where they fill out their income when they come and check in, at the front desk to register, and do a sliding scale fee, which allows them to get a pretty good discount on services. So that's pretty expensive, to get a blood draw or to get seen by a physician, by a provider. And then when we go out and go talk to people in the community, we always let them know too that, we're dealing with hypertension here on the village, here on the island, and we let them know we offer free blood pressure checks, and see if they have Medicaid. If not, we let them know about the sliding scale fee, and it does bring people in, so they are getting access to health care.
That's really great, Karen, because honestly, some people are intimidated by the cost of health care, and they may put off seeing a doctor if they're not sure how it all works. So you guys doing outreach to the canneries and letting those people know who may not have health care, how they can at least get primary care health care access is really huge, and you're actually empowering them to take their health in their hands and get help if they need it, regardless of their ability to pay. So you're definitely helping people in that way overcome barriers to healthcare. Is there anyone else? Thank you, Karen, for that insight. And how do you guys get the word out about your services to the canneries? Do you guys have flyers, or do you just have relationships with the management there? Or?
Yeah, the front desk has a relationship with one of the workers there that's called a safety officer. And then we have flyers in the clinic too, because we've had, some of the cannery workers, they would come up and get seen, and or else it'd be a medical issue. They have to get medevaced out. And then we also let them know about medevac insurance, where, they could buy it for $120, and that will cover them, for a year. If they ever have to get medevaced out, pay that, for a year versus paying $85,000 for a medevac, 65 to 85.
Well, thank you so much, Karen. Linda writes, it's important to educate coworkers, healthcare providers, clinical staff, and admin on challenges for all people. Once they know more, they do better, hopefully. Yes, Linda, we could do outreach right within our own organization, and also you can learn more from individuals within your organization, even if it means taking a couple minutes to talk to providers or front desk staff that might encounter patients throughout the week, and just ask them, have they noticed anything trending? Have lots of young mothers come in that need help with WIC, and letting them know that you're a resource to help people who might experience other social determinant of health inequalities. And having that good referral list on your side will also help you help others. So Kelly, did you have any ways that you would like to help more with wellness in your community, or help with health access?
Health access. I think we're doing we service 5 villages, so I would like to see more community events where we go into the villages and ask what is their concerns and what they would like us to bring to them. We haven't done it for a couple of years, so that would be a starting point to find out what each community wants. Getting people healthy, we're going over one-sheet follow-up on our patients if they call on what to do on process for behavioral health reasons, because as of now our providers are having a hard time dealing with them. So we're going to have a one-sheet process on what to do, who to call, and making life easier for them to get into treatment if they need it. And it's just by self-care.
Yeah. Thanks so much.
We do newspapers, we do flyers, we do Facebook updates, and that's basically what we do.
Thanks, Kelly. There's been some examples throughout the years of community health workers. I know that Karen in particular mentioned hypertension and diabetes and how they're offering free blood pressure checks. Some other things I've seen in the past are people who address the issues of soda consumption and stop the pop kind of thing. I know a couple of years ago in Barrow, they had a campaign going where they were putting flyers all over Barrow telling people to stop drinking so much soda, make sure you drink more water, add fruit to your water. Even little information like that goes a long way. Getting that information out in various areas or even in the lobby of your health center is great. Knowing about tobacco cessation if someone is battling, trying to quit smoking, drinking, drug abuse, knowing all those resources is key. Making contact with those individuals. Even, suicide and counseling services. Knowing all of those things will also help you empower your clients, because you might get different people with different kinds of issues, and knowing where to send them if they have major concerns, or they're suicidal, they're battling addiction. Know your key resources. Try to build partnerships with those organizations so that you can give them a call and say, I have Sally here. She's really going through a rough time. Her husband just divorced her, and she needs someone to talk to. That is helping people, meeting them where they are, and giving a warm handoff to a trusted resource. So those are just some examples of how you can, support and encourage wellness in your communities. Just knowing all those resources and having them at your fingertips. Even having WIC. Don't forget that some families are experiencing not enough food in their household. So being able to ask questions like, is there anything you're struggling with as you meet with clients? Sometimes people are proud and they are private and they are ashamed to talk about things they might be lacking. So easing those tensions and letting them know that it's okay if you are experiencing this difficulty. I'm here to help you, not judge you, and I want to point you in the direction of resolving whatever it is you need to resolve. So that is how we can, help people who might be experiencing lack of power and privilege and accessing health care in your community. So basically that's what I wanted to cover today, and just really talk more in depth about how we can help those in our communities have better access to health care and resources. So if you guys have any questions or concerns, let me know. I am going to pull up our syllabus really quick so we can take a look at where we are in the syllabus. So due to the holiday, I'm not sure that, you guys will be working next Tuesday or the day after New Year, so we just aren't having classes again until January 9th. And then we will be covering Chapter 7. Okay. All right, well, I guess we covered Chapter 6, not Chapter 4 today, guys. So sorry about my misspeaking. So we're going to be into Chapter 7 for the 9th of January and the 16th. So plan on spending, if you can, the next 2 weeks catching up on your coursework. I did want to make an announcement that Litmos is having some technical issues with learner upload modules, and so I had to manually go in and get some customer support help to advance you guys in your assignments. So if you find you're not progressing after you've done your learner upload, shoot me an email, and I do apologize for that frustration. I don't want to hold you guys up, but you should spend the next 2 weeks catching up. If you didn't read Chapter 6, please do so. And also Chapter 7 by the 9th of January. And then we will go into Chapter 7 for the next classes, which will be 1-9 and 1-16. Otherwise, just use this time to catch up on your assignments. And if you should need anything in the meantime, reach out. But we will join together again after the new year on January 9th, and we will cover Chapter 7 about ethics and professional boundaries, which is really important for people in such an important role. So if there is nothing that you guys need any further, I'll just go ahead and end class early. I wish you guys a Merry Christmas and a Happy New Year, and we'll be back here on January 9th. Thanks so much, everybody.
Merry Christmas.
Merry Christmas. Bye-bye.